Somebody says, are the sonic care brushes best? That's the electric toothbrush. My answer is, I use it and my whole office uses it. So that's a statement. The other electrical brushes, I think, are also excellent. But we get the best results with the sonic care, and that's what we recommend to our patients. Why do other dentists know so little on TMJ? Well, TMJ, the jaw joint, is very complicated and has many different aspects, many causes. And the reason I got into it is I sent some of my patients to a TMJ person because I wasn't interested in it. And his name was Yamamoto, and he made both of them worse. And I was really upset that he was an incompetent and his name was Yamamoto. So I started studying and taking courses and everything, and now 30-something years later, I'm a recognized expert in TMJ, to the point that on Google, if you need an expert witness in a court case, I'm on the list. So dentists are not interested because we are talking about the mouth. TMJ is way up here. The mouth affects the TMJ, the bite affects the TMJ. If the bite isn't good, the jaws aren't going to get better. And that's pretty much what I do for TMJ people. I fix their bites when other dentists can't. What can you do to repair gum decay? Well, there isn't such a thing as gum decay, but gum recession, that happens with age. That we can't repair, your gums recede. Some people have gum issues, has to do with home care, diet, and heredity. You can handle home care and diet, but heredity, some families, some individuals that I know that I've treated for decades, and it's been learned that what causes gum problems is a bacteria that is anaerobic. That means it lives inside the gums, and most people have the genes that the white cells can fight these bacteria. Some families don't have that, and they keep their mouth clean and they come and get treated regularly, and they just gradually have bad gums, and that's unfortunate. But that's what we learned. It's some of it's hereditary, and we just do our best to make them last as long as possible. Information on whitening. We have all kinds of things. We have a system in our office that we can do whitening. And one thing I can say that I saw on television says we will guarantee your teeth will be 6 shades whiter. Not true. Even with the best whitening, 3 shades whiter. So when they say it's 6 shades, you know, when you get your 6 shades whiter, it's like life is saying that there's no inflation. So we'll move on. Now the importance of flossing. That's very simple. When you floss, smell the floss. That's what's in between the teeth that you're taking out. And so removing food particles, and you're killing the plaque. And the plaque builds up everywhere, but you can brush it away. In between your teeth you can't, so you have to floss it away. And what you're doing is the plaque has bacteria, and you're breaking up the bacterial colonies, cleaning in between your teeth. You floss first, then you brush your teeth with a fluoride ingredient in the toothpaste. If toothpaste doesn't have fluoride, you're not going to get the effect of tooth decay prevention, because the mechanism of fluoride is it makes your tooth more slick. and the plaque can't form as easily on a slick tooth that has fluoride on it. So dentists are a lot less busy than we were 50 years ago. I remember when I got out of the Army and I had to practice and I'd go to work, I would come home thrashed every day doing so many fillings because people had cavities. And with fluoride, the amount of decay is way down. People are keeping their teeth longer. It's really great. We live in great times.
Yeah.
Why are x-rays necessary for grown adults every year? We take x-rays every year not only to track decay. Someone doesn't have a lot of decay. We sometimes skip a year. But what we're looking at also is the bone around the teeth. And it's important to keep track of the bone, and that's gum disease. So x-rays are necessary for tooth decay and gum disease. Which is best, root canal versus implant? That's a really great question, whoever said that. And my answer is, they're both fine. But a root canal saves the natural tooth. And the natural tooth has a ligament around it. All teeth have what's called a periodontal ligament. And it's like a shock absorber in your teeth. So when you bite real hard, there's a little give in all the teeth. And that's good. Okay. When you get an implant, it's titanium metal in the root, in the bone, excuse me, and it goes around the grooves in the implant, and it's more solid than a natural tooth. So when you have an implant and you bite real hard, the teeth compress a hair, but the implant's hitting harder. So when you deliver an implant, you have to make sure you have the patient bite real hard, then you adjust it, and then you'll have a successful case. But if you don't do that, the implant hits harder, it'll cause other problems. You could crack the opposing tooth or whatever. So my answer is I would rather see a root canal in a natural tooth, and it'll last longer. But when it's gone, it's gone. An implant is much better than a bridge. Because if you do a bridge, you have to cut down the teeth on either side to make crowns and have a false tooth in between. Consequently, I can't remember the last bridge I did. I used to do bridges, and I had a whole presentation of how to temporize when you're making a bridge. I haven't given that presentation in years because people are keeping their teeth. When someone asks me, should I get an implant and get a bridge, I always say get an implant because you're not going to cut down the teeth on either side. And bridges aren't forever, only herpes is forever. What's the difference between a regular cleaning and a perio cleaning? You know the dipstick when you're doing the oil in your car? We have a dipstick in the gums. You put it in the gums, and if the gums separate and goes way down, it's when you're past 5 to 6 millimeters, you're going to have to go to the gum specialist. But around 4, 5, you need extra time on it. So the difference between the regular cleaning and perio cleaning is the depth of the gums. It takes more time to go deep and clean it. And so the hygienists are paid very well. So when they do a deep cleaning, they take more time and more appointments, and they have to be paid more. We actually pay the hygienist more for a deep cleaning session than a regular cleaning. So that's the end of the question. So what I'm going to present today is something that I think I'm going to be doing research on it when I'm doing less general dentistry. I had a tumor on my thyroid 4 or 5 years ago, and I went to see an endocrinologist, and he examined me and said, the bump on your thyroid is non-malignant. Leave it alone, there's nothing wrong, it's fine. So I said, thank you. Since I'm here, I have a question for you. I have had 2 patients that had severe TMJ, bad pain in the jaw joints. And after I fixed them, the pain was gone, they were happy. They got pregnant right away. And I went, gee, it's interesting. And he says, I can't tell you for sure, but what I can tell you is when a patient is in a lot of pain, the pituitary gland, which is the master gland in the body that controls all the hormones that are secreted, when the patient is in pain, that gland does not function normally. And for women, it may give them irregular periods, and maybe they won't ovulate as often, whatever. Because both of these patients were very attractive gals in their 30s and married, and I assume, they had regular relations, but they got pregnant after the pain went away. And he said that's a possibility. And so that's one thing. And the other thing is a case I'm going to show you today is a teenage boy that had TMJ, and he had it so bad he came in and he looked sick. He was sickly, skinny, and I'll show you pictures of him. And after I fixed him, got rid of the pain, then he matured, he got stronger, his appearance was better. And so that's growth hormone and testosterone. If those hormones are decreased, then he's going to be the, kind of sickly type of kid. He wanted to be a rower, so he's on a rowing team. And after I fixed him, he got well to the point that, I'll show you the case. So how do we get started here?
You have to log in here? Yes. You see what's going on. And we'll touch them.
Silence is golden. Over there is the president's. Yeah, I figured it out before. Yeah. Yes, PAC is not an excuse, but it is services. I'm in the gig and I have a company and I have black carpet. You're not allowed food and drink in the bedroom.
Wow.
There it is.
Okay. So this is a young man that had the jaw problems, and one of the things he did to himself, he had the problem for a couple of years, and he went to the store and he bought a mouth guard, and the mouth guard is made for contact sports. It's cushioned between your teeth, so if you get hit, you won't hurt your jaw. You could actually get a concussion like this because your lower jaw hits the upper so hard you get a concussion. Sean knows all about that and his buddies. Yep. But so you wear a mouth guard. But if you try to use it at night as a night guard, when you bite into it, it holds your teeth tightly. And when you grind your teeth, it doesn't allow your jaw to move. So it makes your teeth loose, and then it hurts your jaws because your jaws are not moving normally, and you're torquing them unnaturally. So he was doing that, so I said, don't wear it at night, but do wear it in the daytime when you're rowing. Doing that, okay? But not grinding, clenching, that's fine. Take it out at night, and I fix his bite. So when you look at his neck and the way his head is canted, see, this ear is higher than this ear. Well, that means his head is leaning to the left. This ear looks bigger than this ear, which means his head is turned this way a little. And then his shoulders higher. So, and then you look at his eyes. When you look at eyes, we call those the painful eyes, and people call them sad eyes. And then his posture. See, his hands are forward because his shoulders are rolled forward. And he has a curve in his back. And for sure, his head is forward. And that's a sure sign of jaw problems. Because all the TMJ patients that look at the jaw and their heads forward. So then we go through his complaints, etc. And 3 years of discomfort getting worse, headaches, tension in the jaw muscles. Then I examine them, and these are my findings. And pain after eating a lot of chewy food, that's always jaw pop sometimes, but not today. So I recommended that he use his mouth guard during the day, but not at night. So I'm going to check out because it's too complicated. And for
For generals.
Translation.
You guys are stuck.
Dentist's for
We
dummies.
don't need to be clinical, right? We just need to give us all the benefits.
I mean, you could have just skipped forward.
See, I go to x-rays and I do mouth models,
Faces.
which we've seen before. We've seen rounded models.
Yeah.
I adjust
Stupid ass.
So I have a question for you.
You got the results yet?
Yeah, we want to see the results.
He's done all the complicated, so I don't need to much.
Hey, what do you think? That different?
Yeah.
That's a sickly young man, sickly teenage boy. Look at him now, see?
He looks tough, like I wouldn't want to run into.
Look at his neck. Look at his neck, everything. He's grew his hair more,
He's good.
but he's
That's just in 3 months, less than 3 months.
very, very well developed. That's my. And then you look at his posture. His head more
He's got
upright.
a weightlifting program?
His back isn't as curved. So I think that's it. I don't have to show the whole thing. It takes me about an hour to show the whole situation.
$20.
But I think I got the point.
That's
That's enough for our presentation in the morning.
Yeah.
All right.